Hi, we're going to talk about how to get a little space between the subclavian vein and the collarbone for those of you that have had a pacemaker, because that wire goes in that subclavian vein. So for me, especially when I work out a lot, it starts to get really tight. And one of the things that I feel helps me is when my pec and some of these muscles are getting tight. You have the vein that's going to come, the muscles are behind, you have the vein here, and then it goes up underneath the collarbone. So technically that vein can get sort of like pinched in there a little bit, which is one of the things that they talk about as far as not working out. You want to be careful that the wire doesn't get really pushed up under there. So this is what I do to help with that. So I find the vein, which for most of you, you should be able to find. Mine's pretty prominent. You can almost just see it, honestly. You can see where my collarbone's really visible here, and then it's kind of not. So you can kind of tell that there's something extra there. So anyway, I find it, and then I'm just going to move to the outside of it. And then I'm actually going to kind of just press up under the collarbone and sort of work back and forth. So this is not going to damage at all any of the work they've done. You're working around where the vein is. So I kind of press in there. You can even just press kind of straight down and hold, whatever's comfortable for you. And I basically do the same thing to the other side. So again, kind of find the vein, and I come to the inside there, and then I kind of just do that, the same thing, and kind of press. And for me, I can tell I hold a lot of tension in this area, so it just sort of makes everything feel nice and relaxed there. So again, making sure that you're not finding the vein and pressing right on the vein. You don't necessarily want to do that. You can press gently, that wouldn't hurt. But if you're really trying to dig in, you're going to want to do that to either side. So what I'm really trying to do is kind of relax those tissues from back behind. So it's obviously the collarbone's not going to move. It's going to be there, and that vein's going to be right under that collarbone. But if we can relax that back side, it's at least not getting sandwiched in there. So just giving you some nice space. So this is fine for anybody to do. I would definitely recommend it if you're really active, if you are doing pec stuff, that you're working that muscle. Just help give you some space. I hope that helps.